All right, it's been since May when the CDC last reported the number of COVID infections in the U.S., the number of people who actually have been infected, at least the numbers that they were aware of. Now, why is this information not being shared with the American public? Why is natural immunity not being considered in the various mandates that we see moving across the country, including the federal mandate that the Biden administration is pushing forward? Now, is the government maybe studying this issue and they're going to let us know what they have found later? I don't know. But there is a team at Johns Hopkins Medical Center, School of Medicine, that is leading a long-term study on natural immunity. And needless to say, finding volunteers was not a problem. Joining me now to talk about this study is Dr. Marty Makary. He is a professor at Johns Hopkins School of Medicine and a School of Public Health. Dr. Makary, welcome back to the program.
Good to be with you, Tony.
First of all, let me ask you this question. Why is the CDC not reporting information on infection rates? And I mean, how many people have had the COVID virus?
Well, there's two potential reasons. One is they don't want to know the results, because if you go out there and say natural immunity is durable, one, you have acknowledging you made a terrible mistake when you hedged the other direction. The other possibility why they're not looking at this is it's just an old school mentality that they dug into their position and they're holding to that position. And finally, it undermines the vaccinate every single American with 2 feet edict. And many say that's a simple message we have to stick with. Anything that gets in the way of that message, be it natural immunity, therapeutics, threatens that message. And I think we just need to be honest, let the scientific process go.
I'm all for that. I mean, I'm all for the science, because if the science works and we do it right, we're better off for it. But I think when you start short-circuiting the process, or you don't put all the facts on the table, people have a hard time making informed decisions. So with that in mind, is the CDC, the Centers for Disease Control, is the FDA, is anybody actually, and the federal government, looking at the impact or the effect of natural immunity?
Not really. I mean, not with a real solid effort. For example, they've got, between the NIH and the CDC, $50 billion and 30,000 employees. Why not identify some volunteers who had the infection 19 months ago, say in New York City, and test their blood and report out and let us know what those antibody levels are? Why does my research team have to identify this massive gap in science, this massive failure by our government to do basic research, and then we take on the project? We decide that we're going to do the study. So we've got not 30,000 employees, but I've got about 8 staff, and we're launching the largest longitudinal durability study of natural immunity ever done. It's very doable, so we're taking this on. Now, we'll see what the results show. We have to be open to any result that it may show. The results will be forthcoming in the next several weeks. But so do our public health officials. They need to be honest and open to the results as well. They've got also incredible data on lab tests, people who test positive a second time, months down the road or longer. That is data they've not disclosed, and that's a tragedy. That's data that answers questions everyday Americans have right now.
So, Dr. Makary, what do you hope to accomplish with your study of natural immunity? What do you hope will come from it?
Well, we've got soldiers who have been dishonorably discharged because they've chosen not to get the vaccine, and they have natural immunity from circulating antibodies. They deserve an answer as to whether or not that immunity is in fact real and durable. And so we want to provide them an answer. We've got OB nurses who have been fired after being heroes early in the pandemic. The American people deserve to know the science on natural immunity, and now that we can study it, we should be studying it. So that's what we want to do, is give people more information so they can make their own personal choices. Forever, this entire pandemic, I've been arguing publicly with Dr. Fauci for at least a year when he says natural immunity is uncertain, it's unreliable, it's unknown, and we don't know about it. Well, study it. Here's the data. Let's take a look at it, and let's not make this an argument. Let's use the scientific method.
I mean, I think do we still have a goal of trying to get to this point of herd immunity, or with this Delta strain, is that off the table now?
Well, herd immunity is less of a binary thing. It's not really a finish line. It's more when we see significant slowing of the spread. And the bar changed with Delta. We were in a good spot late spring and early summer, as you remember, but Delta really changed that. And that's why deaths are higher this year probably than last year. Delta is very contagious. So there is a number out there, probably 90% or higher of the population. Maybe we've achieved that now in Texas and Florida and other parts of the country that are seeing significant declines, or maybe they're close to it. It doesn't mean COVID will be eradicated, and I think it's important for people to remember that we're not going to get to an elimination of the virus. We're going to get to lower levels where we can at least get back to some more normal activity.
Right, manageable, where we can manage it with our health infrastructure delivery system. So, as a policymaker, as a former policymaker, I'm going to put myself in the position of a policymaker that's wanting to make decisions based upon the facts when it comes to whether it's the policies of schools, whether you mentioned the military, whether or not we should require every member of the military to receive this shot. Would it not be helpful to have all the facts on the table to be able to see that, all right, natural immunity is as effective, or I've read reports that says it has greater effectiveness against the Delta variant. Wouldn't that be helpful to know?
I think so, Tony. You know, parents right now are trying to decide if they should get their kids 5 through 11 vaccinated when it gets green lighted next week. And this is useful information. If they had COVID before, wouldn't it be helpful for a parent to know that natural immunity at almost 2 years is solid and effective, or it's ineffective and there's no antibodies? That is data that we can get that we don't have, and I think it would be helpful for people. You know, the only data the CDC put out on natural immunity was a 2-month study in one state of Kentucky, and they said, oh, natural immunity doesn't work. Vaccines are better. And we looked at the study. We took a really careful look at this study. It was a sham study. It was jerry-rigged. Why were they only reporting a 2-month window in one state when they've got data on 19 months from all 50 states? They were fishing for the results they wanted. And by the way, both groups, the vaccinated and the placebo and the natural immunity groups, had infection rates less than 0.01% in their study. So it was dishonest. It was manipulative, and it shows their true stripes, but they don't want to see the data that doesn't favor their policy either.
Dr. Makary, as we look at this policy that we have currently, where it is this everybody gets a shot, our policy, everyone's vaccinated, is that because it's easier to manage, or is there something else behind this?
Well, I've had very senior scientists in the United States tell me, look, stop talking about natural immunity because people are going to choose not to get vaccinated then, and it's easier and more streamlined to have a simple vaccinate everybody message. And I think we just need to be honest with the public, because right now public trust is at an all-time low. People don't trust the public health guidance, and this is why. They're smart enough to know we don't see people get infected after natural immunity and get seriously ill, intubated, and die. We don't see deaths after previous infection, with rare exceptions. And people are smart enough to know the clinical observation on the ground is that natural immunity is effective. Why are the public health officials in total denial of this basic observation?
Based upon, you mentioned that next week probably get a green light for the shots for tots, the 5 to 11 getting the vaccine or the shot. Do you foresee a mandate coming from, maybe not from the federal level, but we're already seeing it in California. Do you see that's going to spread once this vaccine is green lighted?
Well, gosh, I always am leery of the fact that folks say, oh, we're not going to move to a mandate, and then lo and behold, you see a mandate. So I do worry about that because we've already seen it in California. California's already said kids need a vaccine to go back to school. Well, guess what? There's going to be unintended harm when you vaccinate kids who don't need to be vaccinated because they have natural immunity. There is a risk of complications after the vaccine. And if the kid has a comorbidity, that is a pre-existing medical condition, it's clear to me they should still get vaccinated because those are the kids who get into trouble with COVID, kids with pre-existing conditions, including obesity.
Right.
If the kid has natural immunity, you don't need to get vaccinated. If the kid is totally healthy, it's a parent's choice, and it may favor vaccination, but we need to respect parents who are concerned about vaccine complications, which have not been really adequately described.
Now, you had looked at this previously among the youth and the infection rate and the vulnerability, the risk level for youth was very, very low. Has that changed significantly, or are we still looking at a very low infection rate and a very high recovery rate for those that get it among the younger population?
So last year, about 300 kids died of COVID, and we think nearly all of them had a comorbid condition. This year, about another 400 kids have died of COVID, and again, we think nearly all of them had a comorbid condition. The CDC won't tell us how many of those kids were healthy. I think that information will be useful. So if your kid is healthy, you may want to consider one dose. You may want to space out the two doses. In my opinion, nobody, kid or adult, should be getting two doses 3 or 4 weeks apart. They should be getting them 3 months apart, where the immunity is then stronger and the complication rates are lower. But our old guard medical establishment is too rigid to change guidance after they issue it with an FDA rubber stamp.
Final question for you, Dr. Makary. Your study, how long before you think you'll have some results to report?
If I had to guess, I would say maybe 4 to 6 weeks. I will post it on social media. I'll be out there talking about it. I'll be talking about it on Fox and Friends this Saturday morning, but we won't have results until about, if I had to guess, 4 to 6 weeks from now. Happy to keep you posted in the loop on it, Tony.
Do you think that could have some influence on the CDC and others who are making policy as it pertains to the mandates?
If our study shows that natural immunity is solid and durable, which it may and it may not show, we'll see, then it will help us create a more flexible vaccine requirement. Because if we would have used a more flexible vaccine mandate, we would have been in a much better situation. We wouldn't have all these layoffs and police officers not on the beat and supply chain problems and a polarization against public health. All we needed to do is use a more flexible policy, and we chose not to do it. If you saw the New York Times opinion piece this week, it said, hey, we need to start acknowledging natural immunity. So even the old guard mainstream media, which has given a platform to this small oligarchy of doctors that have said ignore natural immunity, even they're starting to bend now and recognize we got to be more flexible.
Well, more flexible, more transparent in treating the American people like adults and having conversations with them and letting them make decisions based upon what their doctors recommend, not what the government is demanding.
Yeah, doctors and pediatricians are very good about going over all these issues with individual patients. Let them have a conversation about the risks and benefits and their unique situation, concerns, and goals. And let's let that be the place where medications are recommended.
I agree. It's better there than in Washington, D.C. They don't do much good of administering anything here. Dr. Makary, thanks so much for joining us today. Always great to talk with you.
Good talking with you, Tony. Thanks so much.
All right. I look forward to the results.